Chronic pain can really mess up your day. And in particular, if it's lower back pain, that can impact every single movement that you make. Hello, welcome to Mindfulness Voyage. My name is Ted Meissner. And in today's episode, we are going to be hearing about new research about how mindfulness can change the relationship to lower back pain. Remember to please like and subscribe to these episodes. And now let's talk with today's guest. Our guest today is Wolf Mehling. Wolf, welcome to the podcast. I'm so glad to meet you and appreciate you spending your time with us today.
Happy to do that.
So I'd like to begin by having you just describe a little bit about yourself for those who may not be familiar with your work.
So I'm an immigrant from Germany. I had a private practice, family medicine in Germany. So I'm a family doc by background. I did a second residency in the States and was lucky enough to get on faculty at UCSF and did a research fellowship. And then I started research. So in the last years, I did like 50% clinic, 50% research. And my patients are all having chronic pain. So I'm a kind of a manual medicine doctor with a training in psychotherapy who has a background in family medicine and was lucky enough to be on faculty at UCSF.
Great. Thank you for that overview. And we're going to be talking about new research that's come up. And what I found interesting about this is at the very beginning of the research paper, you talked a little bit about how MBSR, mindfulness-based stress reduction, has shown some beneficial results for people with chronic pain and low back pain. I've done interviews on different podcasts about that before, but you've built on that. And I'm wondering if you could say a little bit about how mindfulness-based pain reduction, MBPR, how is that developed? And how are some ways it's different than MBSR?
Yeah, so there are several elements that have shown possibly being helpful in the last maybe 20 years or 15 years, which were not that clear when MBSR was developed. MBSR is from the 1970s, so it's close to 50 years old. And MBSR has a clear curriculum that is pretty much standardized. It's sometimes a little updated, but it's Kabat-Zinn standard program. So there are several elements of research that I thought would help, or not just me, but we thought could help to get maybe better results from the mindfulness-based intervention for back pain. And that has also to do with my personal experience because I had back pain for 3 years, pretty bad when I was younger, when I was in my late 20s, early 30s. Now I'm in my mid 70s, so a long time ago. And one of the main points for me was that mindfulness is not directed to the pain itself. Mindfulness is the wind in your hair. Do you feel that? Are you aware of your thoughts about pain, for example? Are you aware of your position in space? Are you, that they do, MBSR includes a yoga element that is supposed to help with getting into your body. But mindfulness is about mindful of anything that shows up in your mind. And the classic coping mechanism with pain, which works very well for acute pain, but the science showed not that well for chronic pain, is that you try to distract yourself from pain. So the experience that I had personally many years ago with the type of work like body work, mind body work before at the time when mindfulness came out in the 70s, I had breath work as a patient, which doesn't exist hardly in the States, but it's kind of more popular in Europe. And I'm from Germany, where it's kind of better known. And I learned in that work that I don't have any awareness in my lower back when I had back pain. The pain was like a signal of the body calling my attention to the pain. But because it's an uncomfortable sensation, attention doesn't want to go there. I don't, it's a hard thing to focus really there. But it's possible. And I felt like I learned with the hands-on work, with breath work, to be present in my lower back, where the pain was, in the center of the pain. And that seemed to help. So that's one of a personal experience. And I have some colleagues who know that too. There's a guy in Tasmania, part of Australia, uh, Bruno Kayun, who's a psychologist who did a mindfulness intervention with a focus on pain sensation itself. So he called it mindful interoceptive exposure. So exposure means you expose yourself to the problem itself rather than to anything that comes up in your consciousness. So the focused awareness on the pain sensation itself in a specific way that has to be explained uh, could potentially be helpful, maybe not as the only means to deal with chronic pain, but as an additional means if you can handle it. And that was one element. And there's lots of good arguments for it from other research with yoga people and brain science, what happens in the brain when you focus on a specific area in your body, particularly the pain, in a specific way. So then something happens in the brain that is correlated with a reduction in pain. There's a study that NIH did with a pain research lab at the NIH itself. So it's intramural research that showed that people who do long time yoga, like 30 years or so, who pay attention to the body, yoga is, body awareness, that they have an increased activity in a certain area in the brain called the insula, and that this is correlated with the pain threshold, how much improvement they have there. So that was another hint that this is not just a personal, anecdotal, odd experience, but there might be something there. That was one major thing. So we wanted to have a very specific kind of attention to the pain sensation, which is based on curiosity, mindfulness, uh, being, trying to be with the pain. How to say that? It's not an easy thing because attention is almost like it's like, have you ever had a magnet that is two magnets that are in the wrong way together? They don't want to get together. When they write, then they stick, and then the other way around, they get pulled apart. That's how attention and pain works. So you don't want to pay attention to pain. It's uncomfortable.
Yeah.
To learn to not to go beyond this initial resistance, that's kind of not easy. So that's one element we wanted to change. The other thing is that MBSR has an educational element, which is teaching stress, physiology of stress, how bad stress is in the body, what it does in the body, and how it's related to pain. And that's all good, but it doesn't bring the newer research that has been done in the last 20 years on pain, where it works in the brain, how important the brain activities are, how we think about how the pain that you feel in your low back often starts with something that happens in the low back, but then the brain learns pain, and there's something that happens in the brain uh, that perpetuates pain sensations, and how we perceive pain. There's a lot of research that has been done in the last 20 years, and
And this
that's
is a very big difference that you're bringing up here, Wolf, is that mindfulness-based stress reduction is about the stress response and how we deal as human beings with stress neurologically, how that affects us, behaviorally, what occurs. And this is different. The focus, that spotlight, is turned towards pain because that is not the same thing. And the ways in which we might work with that pain as opposed to stress can be very, very different. So I'm curious how that was maybe structured into the study and the
yeah.
program.
Good question. The, so the one of some of the recent pain research is that the brain revs pain up or decreases pain according to context, according to your mental states, according to past experiences. So the the intensity of pain that you feel is not really proportional to the physical damage in your body. That's the main message. So it's not a good gauge, the pain sensation, for what's really happening in your body, because the brain is so involved in the perception of pain. And so it's like one of the comparisons that we bring in the teaching. By the way, we bring a Lorimer Moseley, you might know this name, from Australia. He's a pain education researcher, neuroscientist, physical therapist, brilliant guy. Uh, he has videos where he presents his own experience of pain, how he dismissed pain when he felt a scratch, but it was actually a snake bite that almost killed him. And then 10 years later, he got a little scratch and screamed like crazy because he had this memory of the snake bite that almost killed him. So the memories, the past experiences, the priors, as we call it, have a major impact on how you perceive your pain. And so the brain can bring the pain down and can bring the pain up. And so we built that into the 8-week program. So we do show video from Lorimer Moseley, and we explained part of the pain as like a parking alarm in your car. So when you park backwards and then you get close to the bumper of the next car, it makes a beep, beep, and the closer you get, the more it beeps. And if your car alarm, if you had an accident with your car, then the car alarm might not work really. It has to be reset. You might get a car alarm already like 3 foot away rather than 1 foot away. So there's a change in the computer system with your car alarm, which is a useful instrument to tell you there's something dangerous, there's danger. So it's a danger indicator, but how much danger there is kind of changed in the computer system, and that's your brain in this case. So
It's such a timely example. I was backed into in a parking lot just this weekend, wishing that that sensitivity had been raised a little bit on the other end of the vehicle. So, with the study, what were some of the results that the participants had?
I want to say the third thing we
Yes,
changed,
please.
the yoga that they use usually in the MBSR program is mostly whatever MBSR teacher has done, we wanted to have more specific exercises that fit with back pain. And there's research that has been done, particularly in up in Washington State, where they did good studies on what kind of yoga works for back pain. So we wanted to integrate that too. Yeah.
Excellent. So
Yeah.
you did the study, and what was found?
Yeah. So the study is not a randomized controlled trial with the control group. So the conclusions that we have, or the summary is, we cannot really prove that what we did uh, caused the change. It could be a placebo effect, whatever. But you can compare the results with how MBSR studies worked, for example. And that's not a direct comparison, but we can say that about 2/3 of patients had a improvement that in this research standards is called clinically meaningful. So we know from other studies how people with chronic pain think what is really actually better than before. That has to be at least in acute pain, it has to be more than 50%. In chronic pain, it has to be at least 30% improvement of the pain rating, 0 to 10, which is not the best instrument, of course, but this is what we have. And if patients say that the pain has improved more than 30%, they are usually somewhat more content after the intervention than before. So they feel like this is an improvement.
Yeah. And what I find interesting about that,
2/3 improved.
setting aside the the challenges that we have with that 10-point pain system, because that's an entirely separate episode, is your
Yeah,
history
yeah.
with that, is that there are changes here, and that an intervention indications are that this can be helpful, understanding there are limitations with funding and all the rest to do as rigorous a research as we might want to. Nonetheless, there are effects here that bear paying attention to. And I'm wondering for you, as someone who has experienced pain yourself, who is a researcher in this area, what are some of the things that's most encouraging to you about this new research and these findings and the development of a program that may help people with chronic low back pain? What is exciting to you about that?
Yeah. So I I think one of the most exciting things for me is that I want to share the experience and the research result that distraction is not the best way of dealing with chronic back pain. And that hasn't been said clearly in pain management and chronic pain management. And there is some research where they tried to check that out, comparing paying attention or distraction, but they haven't done that with mindful attention. So, so the way that mindfulness can actually move the field in chronic pain is by a specific way of attention rather than distraction. And if you pay very close attention to the pain sensation itself in a curious, like you as a patient are part of the research team. You research what is this pain? How is this pain exactly? What's the three-dimensional space it occupies in my body? Is this, it's like a enemy. Okay, well, that's something I don't want to have. I want to get rid of it. I want to root it out or whatever. But to get inside that space where the pain occupies, and to see the first by discriminating qualities. And it's unbelievable what people describe, how different the pain is. And then while they're describing in details the pain sensation in with curiosity, and curiosity means you don't dismiss, right, something. You know what is it really? How does it feel like? And they go into it, then the pain sensation changes. It all of a sudden says, no, it's more like energy. And it's something that I never felt like this before. And it's warm, and some had a beautiful experience while they went into their pain. There's a woman who said, right now, it's like an opening a Coca-Cola bottle. It's like a fizz, and it's like a butterfly moving around. And they had, while they paid attention to the pain sensation itself, if they manage to do that, there's different degrees of how people can do that. The pain sensation resolved or changed. And that's something we in medicine, general physicians, have no understanding there. That there is, I learned that with breath work, that there's actually this a core. I mean, this is now a little esoteric. There's like a center of energy in our body that we haven't used and that we have suppressed, or that's kind of not lived. And there's and people describe that as there's a force in there. And then first it's an alien force that I wanted, and then but you can become friend with it. You can acknowledge it as something that's there. It doesn't go away by taking pills only momentarily. It doesn't go away by hating it. You have to accept it and you have to get into it. And that's a something that it's not easy to share or to tell because it's counterintuitive. It's totally opposite to the usual habits. And people realize that my habit is distraction. I don't pay attention. I don't want to pay attention. It's miserable. To really go inside that sensation, that's something I think is in the next 20 years for the future of pain management. I think that's a raisin to be tasted.
Nice reference. And I agree completely. And this is one of the most fascinating things is how consistent what you've just described is turning towards that practice of mindfulness, that closer connection rather than avoidance and suppression can itself bring tremendous transformation to our relationship to pain, stress, difficult thoughts, whatever it happens to be. And that's counter to our learned behaviors or biological behaviors to want to withdraw from that which is uncomfortable, let alone painful. And so we keep coming to that again and again. For those who are listening to this podcast, as you know, if you've been here before, I'm going to have links to various places, including more information about Wolf and his work, this study, in the Osher Center. I'll have a number of links for you. But I wanted to ask Wolf if there was anything else that you wanted to say to those who are watching or listening to this, maybe those who are encountering low back pain themselves. If there's anything you'd like to share with them.
Yeah, so yeah, it's if I mean people who listen to your podcast are probably already interested in mindfulness, and that you can learn to be present with your pain sensations. You, it's possible. It's counterintuitive. It's not, it's there's a resistance you have to overcome to keep your presence there. It's an exercise, it's a practice, and it takes a while to learn that. So for me, when I was young, it took me 3 years. So with this breath work, so it takes time, and yeah, I have another research study that you might have seen, where we did a phone app paying attention to the pain sensation in the curious way. And so the idea was maybe in the next study that I don't want to lead anymore because I'm getting old. I want to have a little more time. But the next study could be integrating this phone app that that alerts you to pay attention every 3 times a day for just 2 minutes to the pain sensation itself, to practice that into an MBPR program to really practice that attention there, the attention training.
It can be helpful to have structure and reminders in whatever the practice happens to be. Mindfulness is one of them. Well, our guest today, Wolf Mehling, thank you so much for being here, for sharing about this research and for those who've been here before, not at all surprising idea that turning towards even difficulties can really help us change our relationship to them.
Mhm. At least what most said is takes the anxiety about the pain away.
Thank you so much for listening. And again, please do like and subscribe. It helps other people find these episodes as well. And it's interesting that here again, turning towards even difficult experiences is the best way to work with them and maybe change them. Remember, every moment you have a choice. Make it the best you can, and I'll see you soon on Mindfulness Voyage.